Foundation is making history in Rwanda by supporting the training of the first fertility specialists and embryologists for the first public IVF center in Rwanda, which will leave a strong legacy in shaping the quality, safe and equitable fertility care landscape in Rwanda and East Africa. Through More Than a Mother movement, Merck Foundation is determined to empower infertile women in Africa through access to health, information and change of mindset, and encourage men to speak up about infertility issues and support their wives in the journey of making happy families.
I'm Dr. Rwanda Which. I'm working at Butare University Teaching Hospital in the southern province of Rwanda. I'm among the first doctors to be trained by Merck Foundation in the program Merck Fertility Training Program, and we have been trained in India, in the Bangalore, at the Miran Hospital.
I'm Dr. David Mwesje. I'm a gynecologist and obstetrician, and I work at Rwanda Which Hospital, and I'm one of the first trainee of Merck Fertility training program, and I was trained as a fertility specialist.
I'm Frederick Miseneza, embryologist from Rwanda Which Hospital, and it is the first center established by the government.
So Rwanda Which Hospital is a government referral teaching hospital. We as doctors working there, being a military hospital, we receive 90% of people from the rural areas. So this service that was initiated there was initiated with the goal of helping these patients receive infertility service at a low cost. So infertility really is a public health problem. So the challenge that we face, I was trained as a gynecologist for sure, but being in a sub-Saharan Africa, whereby one of the government priorities are like HIV, we face a problem. So these patients are always not left. Their statistics are not well known.
To me, it was a privilege to be part of the Merck Foundation, to be chosen by Merck Foundation, because here in Rwanda there was no one who was specialized in handling the infertility issue here, and we were trained in really a good hospital in India. So it was Miran Hospital, and it is a highly qualified training center, because all over India it was among the first clinic who are training specialists, training embryologists, and who also is handling highly complicated issue in infertility in India.
So when I was in India, I was able to learn sperm analysis, IVF, intracytoplasmic sperm injection, freezing methods, sperm donation and oocyte donation.
The knowledge that we got from this training, the Merck Fertility training, was so helpful. Say that whenever I meet patients that have had this problem in fertility, we are to help them. Helping them is not all about even IVF. Like as a package of training, we learned a lot. We learned how to counsel patients. We learned how to raise hope for these patients. We learned how to provide affordable diagnosis, and we also tell them how IVF can be successful, and they go in with full confidence.
This really was really a good training. We have learned a lot during the training, and when we come back, it was a pleasure to start to help different couples who are facing infertility issues. Maybe I can just address one of the stories, successful stories of people who were facing those problems before. When I come back in the month of January, I met a couple who had infertility for 10 years and another couple who had infertility for 9 years. So the two couples, there was no previous pregnancies, and they were really hopeless couples. And by applying the knowledge we learned, and we really helped those couples. And 2 weeks ago, the first couple really delivered the first baby. It was really a lovely baby of 4 kilograms. And the other couple is now having a pregnancy of 8 months. And without the training, there could not be those couples will not really have the chance of being helped here, because they have 3 different areas here, but they didn't really get pregnant. But by applying what you have learned, and with the regular follow-up of those couples, we finally succeeded in helping them. And I'm happy that one of them is now having a baby right now. And the other one also is expected to have her firstborn. After nine years, he's having her firstborn this coming January. It's really something that was impressive to me.
You're really the success stories that I can tell you after undergoing a training from Merck Fertility training program. I have had women conceive. And really they've had transfers to where I work, Rwanda Which hospital, and they even in other clinics we help, even doing outreach program, because we do outreach program by government. I see them and I've helped them, and they have conceived, and really they are happy. And before the training hadn't got any success, but now I'm seeing it working, so it's really grateful. Really, this training is very vital, very important. So being the first batch to be trained in Rwanda in fertility training by Merck Fertility training program, we are very few. So I will recommend other gynecologists to take up this training, say that you can be many to tackle this program, because being few doctors it's not enough to handle.
I'm really thankful for the Merck Foundation, and I'm happy to be part of this program, and I can say that this training has contributed a lot and has changed the lives of different couples. So I'm really thankful to the Merck Foundation, and I would really be continuing to help people by the knowledge I get through the Merck Foundation.
I thank Merck more than Mother for having given us this opportunity to training, to get skills in infertility, and we promise that through their cooperation we are going to aim high and help our women. So thank you very much, and together we can. So thank you very much, and keep seeing how we are growing and helping our community.